cardiovascular health, in June 22, the American Heart Association updated the Life Simple 7 construct to Life Essential 8. However, today, there is a lack of studies examining how well the novel Life Essential 8 construct reflects cardiovascular disease, including coronary atherosclerosis. The main take-home message of our study is that the novel construct of the American Heart Association conveys coronary atherosclerosis, thus serving as a useful tool to monitor cardiovascular health. I am Ángel Raizudillo, a postdoctoral researcher at Linköping University in Sweden, and I am the first author of the article entitled Life Essential 8 and Life Simple 7 in relation to coronary atherosclerosis, results from the population-based escapist project. This article is now published in Mayo Clinic Proceedings.
Our study involved nearly 25,000 middle-aged participants from escapees. The novelty of our study is that we didn't just focus on coronary artery calcium scores, but we also incorporated data in coronary, computed tomography, angiography, stenosis in the 11 most clinical relevant coronary segments. That's providing information in both calcified and non-calcified plaques at a population level. In our work, in multinomial logistic regression models, the novel Life Essential 8 score proved to be strongly dose response and inversely associated with all coronary atherosclerosis indicators. And interestingly, these associations were stronger for severe indicators, specifically coronary stenosis above 50% and CAC score above 100 Agatston units. For example, participants with less than 50 points in the Life Essential 8 score that can be considered as having poor cardiovascular health had 11-fold odds ratio for severe coronary stenosis in comparison to a population with 80 points that can be considered as having excellent cardiovascular health. An interesting finding in our study is that 42% of the population had any level of coronary atherosclerosis, and 6% of the population had severe coronary stenosis. Due to these high prevalences, the above-mentioned relative associations also translated to very important absolute metrics. For example, in a population with ideal cardiovascular health, the adjusted marginal prevalence in the proximal left descent coronary segment was something like 21%, but this prevalence rises as high as 42% in a population with poor cardiovascular health, which can be considered a dramatic difference. The Life Essential 8 score is a simple metric. It is just based in 8 well-known and modifiable health behaviors: diet, physical activity, nicotine exposure and sleep health, and health factors: blood glucose, blood pressure, body mass index, and non-high-density lipoprotein cholesterol. Since this score ranges from 0, indicating the worst cardiovascular health, to 100, indicating the best cardiovascular health, it can help to easily monitor and measure cardiovascular health, which could have substantial implications for clinical practice. An interesting finding is that in our work, the capacity to predict coronary atherosclerosis was comparable between the novel Life Essential 8 score and the previous Life Simple 7. That's proving that both American Heart Association scores are useful to monitor cardiovascular health. While we acknowledge that it may not be easy sometimes, the recipe for a good cardiovascular health is quite simple. In our work, both health behaviors and health factors were closely associated with coronary atherosclerosis. Thus, it's important that patients be motivated to incorporate health behaviors and positive lifestyle changes in their lives. In addition, not only clinicians, but also patients should be aware about the importance of measuring health factors in their lives. This is important, especially considering that the bad control of these health factors usually is asymptomatic.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.